All right, so we're going to look at the joints of the pectoral girdle, and we're going to separate out the pectoral girdle from the GH joint. But the shoulder joint is an inaccurate term because there are many, many joints that make up this shoulder complex, including sternoclavicular joint, the glenohumeral joint, and the acromioclavicular joint. And then we sometimes refer to the scapulothoracic joint, which means it's between the scapula and your thorax, or the ribs. That is not a real joint between bone and bone. It's more of the scapula being connected by muscle, and not ligaments, which makes the range of motion and all the motions of the shoulder joint complex to have a very large range of motion, which is advantageous. But it does get a little confusing when you have to understand all the anatomy and functional anatomy. So let's look at the sternoclavicular joint. So here is the manubrium of the sternum. Here is the clavicle, both clavicle going lateral, and then our first rib. So sternoclavicular, it's between the sternum and the clavicle. So it's this joint right here. And it is a saddle joint, so you have quite a bit of motion, range of motion at this joint. So a few ligaments that you need to know. The interclavicular ligament, and you could probably palpate that ligament on top of the manubrium of your sternum, right here. You also have the anterior and posterior sternoclavicular ligaments. So between the sternum and the clavicle, so you have the anterior here, and then the posterior we're not able to see on this image. Then you have the costoclavicular ligament, so between the ribs, costals, and the clavicle. So this is your costoclavicular ligament. So let's go to the other side of the scapula. So the other side of the clavicle. So the clavicle articulates the sternoclavicular joint more medial, and the lateral to the sternum is the acromioclavicular joint. So between the clavicle here and the scapula. So you can see the scapula here, coronoid process, and the acromion process. So this is the acromioclavicular joint, or sometimes called the AC joint. So the ligaments you need to know are the coracoclavicular ligaments. So those are between the clavicle and the coronoid process. So we have one here and one here. And remember, ligaments, even though it seems overwhelming and confusing, the names of the ligaments are basically the parts of the names of the two bones that it connects. You also have the acromioclavicular, so from the acromion process to the clavicle. So the acromion process over to the clavicle is the acromioclavicular ligament. We also have the coracoacromial ligament. So that is between the acromion process on the scapula to the coracoid process of the scapula. So it's basically a ligament between two parts of the same bone. So this ligament right here, coracoacromial, and that creates kind of the roof of this GH joint right here. So this is our humeral head and our glenoid fossa underneath all that capsular tissue. And then the roof, if you will, of that joint is the coracoacromial ligament.